So nowadays, I mean, if we just take the history, I remember those olden days where medical students, they used to go to library. It was called like National Medical Library, adjacent to All India Institute of Medical Science in New Delhi. But now, since technology is evolving so fast, I mean, those were the times when students used to go to library, request librarian to issue some books. And now, with the help of technology, everything is available on fingertips. I mean, if we ask, take example of say Google or anything, and what has advanced most in medical line with the help of this clinical decision support system, like up to date. I mean, it has helped a lot as far as medical students are concerned, and not only for medical student, it has helped a lot on clinicians. Earlier, I mean, if you are taking rounds or going on rounds, it was not very easy to remember things by heart. But with the help of clinical decision support system, now you can download this in your mobile. And for example, if we are taking around in medical specialty or surgical specialty or oncology specialty, so we have got enough evidence-based protocols out of these specialties. So it becomes very, very easy that there is a access to consultants, there is a access to residents, and there is a access to paramedical workers, because everybody's nowadays is going on evidence-based medicine. So I fully agree with you that if CDS systems are being used in any hospital at different levels, it will create a niche as far as patient treatment is concerned, because there is a direct evidence in the data and clinical outcomes. How do you say it is better? And nowadays, even in medical science, things are evidence based, but uh, uh, in other system, like in research, so up to date has also done a lot of research that a Japanese study had shown that diagnostic error rate was 2% uh, in the evidence-based research with the help of up to date. And there was a study where there was no help of CDSS, and the diagnostic error rate was 24%. So you can see the difference between 2% and 24% in diagnostic errors. So what CDSS help? There are lab-based evidences, so that helps. Similarly, there was another study which was done in NHS Singapore. As you know, NHS Singapore is a very reputed organization. So they have also done a study, and where it was shown that the patients on whom the help of CDSS was used, the results were better in the tune of more than 25%. So it is not that there is only verbal evidence, up to date helps. It is a research based, data based, percentage wise base, enough evidences that it helps. Time has changed. Patient expectation has increased very considerably, and everything is involving around patient and patient engagement, patient empowerment, because with help of technology, patients are also up to date. They know, I mean, with help of technology, they know what is the disease, what are the alternatives. So in this way, uh, I also want to thank, like in India, earlier there was no concept of quality care in India. There was only ISO was there till 2005, uh, but ISO is also meant for non-healthcare industries. Like if you want to have a ISO standard in textile mill, you can have, but few hospitals have initiated their journey with ISO. So I remember with my experience, I was also a management representative of ISO. So ISO was very, very good as far as documentation was concerned. But now in last 15 years, in Indian healthcare scenario, NABH has come, and NABH is National Accreditation Board of Hospital and Healthcare Provider. And in 15 years, they have also tried to put the system in hospital based on evidence-based or guideline-based. Like earlier, it was not there in first edition, but every 4 years they are changing the editions of NABH. But in now fifth edition, lot of clinical things have come. Like for patient, it is clinical outcome, but from for doctor it is clinical outcome, but for patient it is patient related outcome measures. How a patient feels after the surgery. Doctor may be very good that operation is successful, but patient's response to the surgery is also very, very important. So in this way, if there is evidence-based medicine protocol guidelines on one hand, with the quality health, and secondly, if there is a clinical decision support system with the help of up-to-date, which is available to residents, consultant, physicians. So if both can be merged together, I am sure with help of that, already Indian doctors are considered the top. But I think if they are using this, it will become very good. I will just give you a few examples in this. Like critical care society in India, uh, it has evolved very nicely in last 10 years. Earlier only anesthetists used to look after critical care, but now in last 10 years critical care specialty has developed in its own. So national board has also started DNB, NCI, or now what is called National Medical Council. They have also started even DM in critical care. So with the help of this society guidelines and with help of this evidence-based CDC guidelines, and they are also following the same. So then to patient, it becomes very, very important, and there are enough evidences that if in hospital things are done as a protocol, then definitely results are very, very good and better. Just to give you one practical example, if in Indian setting, if there is a heart attack to any patient and the patient goes to any hospital, there are very, very good lines of protocol developed by American Heart Association and up to date supports them. So for example, if any patient of acute heart attack or acute myocardial infarction, he lands in hospital, and if with help of NABH, hospital has protocols based on American Heart Association with the help of CDC, then they try to put those system in place, and definitely patient outcomes are better. Another evidence based protocols which has developed recently is involvement of clinical audits in hospital. Earlier, clinical audits were not done, but now with the help of NABH, they have made it mandatory that any hospital which has got NABH, they have to do one clinical audit per department per year. And the basis of clinical audit is only these guidelines. It can be national guideline, it can be international guideline. And from where these guidelines are coming? These guidelines are being developed through evidence-based medicine from clinical decision support system only. So in my experience, I have seen it is a journey, but in last maybe 5 to 7 years, there is a lot of improvement in this, and there is a long way to go. Okay, so coming to that, in relation to Indian healthcare, there are only three things which are very, very important. So one part is quality healthcare, second part is education, and I also want to thank Indian government. Like earlier, the number of postgraduate seats were very less, but now with help of national board, in last 3 years, the number of postgraduate seats has been doubled. In fact, I was in a virtual session like this 3 days before with chairman of national board. So the plan which he has for next 4 to 5 years, So I think India is already on the top, and there is, we always say that India is lacking the doctors. But I think now things are changing in healthcare scenario. A lot of postgraduate doctors are coming now. So that was about the second thing. So one is quality, second is medical education, and third thing, if it is rightly merged with clinical decision support system, so then the clinical outcomes are very good, patient satisfaction is very good, results are very good, because these are all evidence based. And just to give you one example, like if we take off government medical colleges, so some of the government medical colleges are using this platform very, very uh, significantly. And I had another interaction with the CMC Vellore. CMC Vellore is a private academic, very, very prestigious institution. So they have make it mandatory that the doctor who joins there in CMC Vellore, he has to have to download his up to date on his mobile. I mean, although it is very, very expensive, but still in last 4 to 5 years we have seen the rates of up to date, which was very expensive earlier. It was in so many $1,000 per annum. And I think now, I'm sure with this 30th anniversary, the rates will further come down. So accessibility is there to the doctors. But doctors must understand that this is the high time they must use this, because it is very, very valuable to them. Another important aspect is it is a ready-made material. Suppose I am a medical student, and I have to go to seminar, or I have to present my thesis topic. For example, it is on, say, medical oncology, any cancer. So if I want to study head and neck cancer, so whatever information I want in clinical decision support system about head and neck cancer, I can get. What is the incidence, in which states of India it is highest, what is the best treatment modality, whatever research has been done based on head and neck cancer. So like that, I mean, I can get a PDF, I can print it out, I can get a presentation, PPT format on head and neck cancer, like that. So in this way, it is very, very helpful to student also, and day to day consultant also.